Hello, everyone. On behalf of the Spina Bifida Association staff, welcome to this webinar presenting SBA's Community-Centered Research Agenda. My name is Judy Thibodeau, a member of SBA's staff, and I and my colleague, Juanita Panletter, will be with you for tonight's presentation. This webinar will be presented by Laura Carlson, SBA's Research Coordinator, in collaboration with leaders of the Research Topics Working Groups, Mary Ellen Kelly, Jenny Briggs, Audrey Roach, B.T. Trierweiler, Hubert Swana, and Jennifer Tudor. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible during the presentation. You may use the chat function to talk with other participants. You will receive the recording of this presentation and an evaluation survey after the session. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. We will do the drawing for the Amazon gift card at the end of the presentation, and you must be present to win. Lastly, today's event is being recorded and we will post the video to our website soon. Now on to our program. Laura?
Hi, thank you, Judy, and thank you all for being here tonight. We have an exciting program and you make it all happen. So thank you again. So basically what we're going to do today is we're going to go over the Spina Bifida Association Community-Centered Research Agenda, basically how it formed with your help. We're also going to talk a little bit about the Research Advisory Council, which is the acronym RAC, and the 6 working groups that Judy mentioned the leaders of, some of whom are here in person as well. We're also going to view short clips from each of the work group leaders about the ongoing research that the members of that working groups are conducting. For example, this is the order we will go in. Bowel Incontinence is about 4-minute video, Urinary Incontinence, 1.5 minutes. Then we'll break for some questions and answers, about 3 minutes. So we're hoping we can answer as many questions as possible, but whatever questions we don't answer, we will keep them and try to do our best to send out answers or responses when the recording is done and we send that out. After the first 2 sets of videos, we're going to move to the second set, mental health and weight management. And then again, we'll have a break for questions and answers. The third set of videos, self-management and transition, and then break, questions and answers. We'll have the drawing and we'll say thank you again and wish everyone happy holidays. So very exciting program. Let's get started. So you might be asking, what is the Spina Bifida Community Center Research Agenda? And you might be asking this because we invited you tonight to share what this is, but also this was a process that SBA started back in 2019. And so it took a while to develop, and now it's fully functioning in terms of we have working groups that are paying attention to each of the questions that were developed. So I'm only going to go through a little bit of that process, beginning with the, an application to be on a committee, establishing a committee. It's important to emphasize that at each step of the process of developing this community-centered research agenda, you all were influential, because without you, we wouldn't have this agenda. You helped identify what's most important, which is what has focused our attention in each of the work groups. So parents with children who have spina bifida, adults with spina bifida, such as myself, and healthcare providers and researchers have all participated in this process. They identified some gaps, they surveyed 20,000 members, and ultimately, there were 6 top issues that were identified as most important to adults with spina bifida and parents of children with spina bifida. That led to our 6 working groups that we talked about: bowel incontinence, urinary incontinence, mental health, weight management, self-management, and transition. These groups developed some questions. Again, we went back to the community and with your help, identified a ranking order for those questions because we can't answer everything. We got to start somewhere. So we're starting with 5 or 6 questions per group that were identified as most important among you all. And that led to the creation of the Research Advisory Council. This was formed in March of 2020, and the purpose of this advisory council is to kind of supervise and manage the working groups that are conducting research on the questions that you all have. Again, important to emphasize that the Research Advisory Council is comprised of a mix of parents with children who have spina bifida, adults with spina bifida, healthcare providers with spina bifida expertise, and research members. Each member of the Research Advisory Council serves on one of the 6 working groups, and each of the 6 working groups is led by a member on the Research Advisory Council. So we'd like to get started with the first working group and what they've been doing and the exciting research projects they have underway. And that group is bowel continence or bowel incontinence. The work group leader is Mary Ellen Kelly, pictured there. And in this group, they have several questions that they are addressing, and Mary Ellen will tell you about it in the video. But so that you can see the questions that you all identified as most important in this topic area, I thought we would present them tonight. For example, number 1 question was, how do long-term, large volume bowel irrigations affect colorectal health and bowel continence? What is the association between bowel continence in childhood and early years on the transition to adulthood? Does initiation of a bowel program early on, before the age of 3, predict long-term bowel management compliance? Does it predict short-term or long-term continence outcomes? Does close follow-up after changing a bowel program predict short or long-term improved bowel continence outcomes? And what factors help predict bowel continence, and what can healthcare providers do to help improve continence, particularly among those who are in the lower income or lower socioeconomic status? So these are the questions, and we're going to move now to the video. So please enjoy the video and think about any questions that you might have, and think about how the research that we're doing in these working groups can really help you.
Hi, I'm Mary Ellen Kelly. I'm a nurse practitioner and work at Duke University in Durham, North Carolina. I am very excited to be talking today as the lead of the Research Advisory Council subgroup on bowel continence. I have been working in spina bifida clinics since 2010, both at the Children's Hospital in Orange County and now at Duke, where I've been for 8 years, and my clinical interest has kind of focused on neurogenic bladder and neurogenic bowel. So our group has been pretty active over the past year or so. We have a couple ongoing projects. So we have one project that is looking retrospectively using information from the National Spina Bifida Patient Registry. And we're looking at different surgical variations for MACEs and cecostomies. So different bowel programs that you utilize surgery for or procedures for. That study is being led by Dr. Jonathan Ruth, who is a urologist. We also are doing a really interesting longitudinal study. So we're looking at patients over the course of about 10 years and utilizing the National Spina Bifida Patient Registry data again for this project. And we're looking to see if children who achieved bowel continence earlier in life, so say childhood or early teen years, if following them for 10 years, if they were able to continue to keep their continence level similar into young adulthood and adulthood. So this has been a really great project from this group. It's taken us about a year or so to kind of design it, and it is now being under data analysis at the CDC and is being led by Dr. Heidi Castillo. We also have a few things that you may have seen out there, some surveys, and we're happy to announce, give an update, that we were performing a survey of adults who are utilizing different bowel management programs, and kind of where are adults who don't go to multidisciplinary clinics anymore, where are they getting their bowel care? This is being led by Dr. Carmen Tong at University of Alabama. We were utilizing social media and the SBA and email, et cetera, to try to recruit these adult volunteers to complete the survey. And we now have over 100 participants, which was our goal. So thank you to everybody who helped out with that. One other thing that we are hoping to move forward with over the course of the next year is looking at the implementation study. So really trying to get the lifespan bowel management protocol, which was developed in partnership with the SBA, implement that into clinics and kind of understand what the barriers are to implementation and how the protocol may actually improve continence, independence, and constipation across the age groups. So we're really excited about that group, a subgroup of individuals from the bowel continence working group met just last week about that. So we are hoping to get that kicked off and submitted to the NIH sometime in the first half of next year. So we think that this is a really important working group. Obviously, this has been ranked really highly by individuals with spina bifida and their caregivers and us as providers, that bowel continence has such a big impact on quality of life, as well as primary and secondary health issues. So we really hope that by focusing on these 7 questions you see on the screen, or 6 questions you see on the screen, that we'll really be able to make some long-term impacts pretty quickly with our research. So thanks.
I hope you enjoyed that video from Mary Ellen. We're going to turn now to the next working group, Urinary Incontinence, work group leader Hubert Swana, Dr. Hubert Swana, who is actually with us tonight. We'll begin with the questions that this working group is focused on. Again, the questions that you all would like us to try and provide some answers through research. What is the change in continence for those who have a bladder neck procedure carried out? What is the change in continence for those who undergo any type of bladder augmentation? Is there a change in the number of confirmed urinary tract infections as an individual has after they've had a bladder surgery? What is the association between time and the type of training for intermittent cathing, and then the compliance? Does it make a difference with compliance? What is the rate of frequency that urinary continence is discussed in relation to its effects on sexuality and on sex? Does distance or proximity to a multidisciplinary spina bifida clinic affect continence outcomes and renal functions? They also are looking into what are some factors that can be changed, modified, that can decrease the health disparity of urinary continence in the spina bifida population. So we will turn to the next video and hear what's going on in that working group to address some of these questions.
Hello, my name is Hubert Swana. I'm a pediatric urologist and the medical director of the Spina Bifida Clinic at the Arnold Palmer Hospital for Children here in Orlando, Florida. I'd like to take the time to share with you the work has been done by the Urinary Incontinence section of the Research Advisory Committee. We work closely with spina bifida patients and their families to determine which research questions were most important to them. After several working group sessions, we identified key areas that still had unanswered research questions. Currently, our group is going to use national spina bifida registry data to examine the impact that distance from spina bifida clinic and providers has on urinary continence and renal function. Another question that was inspired by the Research Advisory Council involves understanding the intermediate and longer-term results of bladder surgery on continence. This study will also use registry data and builds upon a previous study by researchers from Duke University that examined short-term data. In the future, we hope to conduct research to help understand the impact that urinary incontinence has on intimacy and sexuality. And lastly, we hope to be able to share these results with the Spina Bifida and scientific communities in 2024. Thank you very much.
I hope you enjoyed that video as well. Now we'd like to take time to see if you have any questions. And I have some questions for you, but before we turn to my questions, I'd like to turn to Juanita and ask, do we have any questions from our participants?
Thank you, Laura. No, we don't have any questions yet. So if you're thinking of one, this is the time to submit your question.
And while you're thinking of a question, I'll pose another one that you can think about and answer in the question and answer, or you can put it on the chat as well. So Mary Ellen talked a lot about various studies. One study that was particularly exciting for me as an adult with spina bifida was the study that is ongoing right now for adults. Where do they go for bowel management, and what bowel management program are they using? And for me, I found this very exciting because it's important information for your providers. Are you going to your primary care physician, for example, to get your information about bowel management as an adult with spina bifida? And if so, would you like to have some guidelines or some research that you can provide your primary care physician to help better manage your bowels as an adult? And so when I saw this study, I thought, oh, this is great. I can really use this information. Does any have any responses, Juanita?
No responses yet.
Okay. Similarly, in the urinary incontinence, the study about distance from a spina bifida clinic and urinary outcomes, how might that be helpful to you? It might be helpful to know that whether or not how close you are to a spina bifida clinic can change the outcomes of incontinence, and perhaps not for you personally, since moving is quite difficult, but for health, this information can be really useful for your healthcare providers, because maybe they need to find different strategies to reach out to those patients who live further. And this is a question that was really important to you all, but it's not answered. And so it's exciting to see that this project is going to hopefully provide some answers to this hypothesis. Any comments or questions from the participants?
We do actually. We have a comment. We have a chat from Katie Schmidt, and she says she agrees, Laura, about the need for different strategies for those that live a distance from a spina bifida clinic.
Thank you, Katie, for sharing. There are a lot of other questions in this area of research that hopefully will help people with spina bifida live better lives, improve the quality of life. If there are no more questions, I'd like to move on to the next two work groups. Juanita?
That's fine. There's no more questions just yet, but if they roll in, we will let you know. Oh, there's something just popped in. What is this? A question just popped in. Is there a correlation between increased bowel incontinence in persons with spina bifida as they age?
What? Would you mind repeating the question again, Juanita?
Sure. Is there a correlation between increased bowel incontinence in persons with spina bifida as they age?
Oh, as they age.
So I want to jump in, and I bet Hubert will have something to say. This is Judy Thibodeau. We don't have data that say that. Now, maybe because we haven't looked, but I don't think there's data to say that as you age, bowel incontinence will increase. I do think we know from our community that bowel programs will need to change as people get older. Hubert, do you have another thought about that?
No, I agree with the fact that there isn't data, but yes, and even for folks without spina bifida, their bowel sort of habits seem to change as well as they age, and it can do anything from diet to activity levels to other medications. So yeah, it will be important to, over the years, understand just exactly what is going on. So I think that it'll be an important area of research.
And we have another question that asks, are any adults with spina bifida involved as paid researchers in these studies? Not just as volunteers, but we also need to make sure adults are gainfully employed. I say this as a longtime gainfully employed adult with spina bifida myself.
So the question is, in these studies or as researchers?
In
The
these
question,
studies.
In these
Yeah.
studies?
Yeah.
Well, I don't know the answer to that because we haven't had the analysis for some of these studies, but that is an important piece of information that is being collected and that is analyzed as part of these research questions, whether or not the person is employed. Judy or Hubert, any other thoughts?
I know that in our studies, to my knowledge, no adults with spina bifida are paid. I think in some studies that our research community, Laura and Juanita, are particularly involved in, some of the research of the participants are paid. And it depends on the impact, the distance they travel, the time the study takes, and so forth.
And typically that payment is, at least in the studies that I've SBA has been involved in, it's a gift card or it's something, it's not a paycheck for that one might be
right
used to. Great question.
Maybe I misunderstood the question. Was the question, are members of the Research Advisory Council being paid? Was that the question? Or I think it's a volunteer force.
Are adults with spina bifida involved as paid researchers in these studies? Not just as volunteers. Yeah. Mm-hmm.
Okay. I didn't know. I didn't understand the questions.
In the interest of time, Laura and Juanita, we probably got to move on.
Thank you so much for your questions and for the comments in the chat. We'll move on to the next two working groups. So our next working group is on the area of mental health, and the leader there is Ginny Briggs. The questions that this working group are looking at begin with, what is the correlation between depression and the degree of involvement in the community activities for adults with spina bifida? And there, the hypothesis is that the more they're involved in the community, perhaps that has a positive effect on one's overall mental health. Specific to children with spina bifida, what are the mental health concerns faced by their parents, and systems and structures? What systems and structures are needed to address those effectively? What generates mental health inequities faced by individuals with spina bifida? What factors that support mental health are correlated to a better quality of life in those with spina bifida? Do treatments for mental health disorders have significantly different effects in those with spina bifida? And what types, look at my notes for a moment, pardon me, because my things, I can't read my question. There we go. What types of system changes are needed to confront mental health inequities for individuals with spina bifida? So we'll move to the video where Ginny will share what this group is working on in these particular questions.
Hello, my name is Virginia Briggs. I'm an epidemiologist and associate professor of public health at Massachusetts College of Pharmacy and Health Sciences in Boston. I am also the parent of a 23-year-old girl with spina bifida, and I have served on the board of the Spina Bifida Association of Greater New England for many years, and spent 2 years as the chair of that committee. More recently, I've served on the Research Advisory Council with the Spina Bifida Association, and now chairing the mental health group to first establish the research priorities in this area, and second, to work together to explore ways of addressing those research priorities. The mental health group consists of clinicians, including psychologists, researchers, and adults with spina bifida, as well as parents of children and adults with spina bifida. Our priorities included things that could affect mental health, such as community activities, access to mental health care, treatment, and social support. In published research, there's been some research on mental health in people with spina bifida, but not a lot, and the studies have been small. The mental health group decided that the best way to start would be to understand what the mental health status is, or how people are doing in a large population, which would be very helpful for researchers when they're designing their studies. We decided that the best way to get that information would be to explore the already existing Spina Bifida registry. This is a system already in place in the United States and overseen by the Spina Bifida Association and the Centers for Disease Control, CDC. And the purpose of the registry is to regularly collect health information from people with spina bifida who visit many of the spina bifida clinics across the country for both children and adults. What we learned is that there is currently no medical health information collected in the registry. And while some of the clinics collect mental health information on their own, they use different types of questionnaires to measure mental health, which means that they cannot be combined. So the mental health group is working to establish one questionnaire that measures mental health and to add it to the registry so we can combine information from all the clinics. Over the next year, we are working with just a few of the clinics to pilot this questionnaire, to try it out, see how it works, and hopefully be able to expand this idea to include all the clinics in the registry in the future. The mental health group is very excited about the work we're doing and look forward to continue exploring ways to further research in the area of mental health for the spina bifida population. Thank you.
I hope you enjoyed that video clip from Ginny Briggs on the mental health group. We'll take questions about that in just a moment. We're going to turn next to the weight management and weight-related behaviors work group. The leaders there are myself and Jennifer Tudor. And the questions that we are researching are for people with spina bifida who have been able to maintain or improve their health. What factors led to that success? What things make it difficult for someone with a disability to exercise regularly? Here, for example, we're looking into the adaptive gyms, for example, or transportation. What difficulties do adults with a disability encounter in healthy eating and independent food preparation? And how do the habits of someone with spina bifida and have resources provided early in life affect physical mobility and function across their lifespan. So we'll move to the video that I recorded. Hi there, my name is Laura Carlson. I am an adjunct faculty member at Benedictine University in Lisle, Illinois. I am also the research coordinator for the Spina Bifida Association and an adult with Spina Bifida. I'm excited to be here today to talk to you about the work group that I co-lead from on the Research Advisory Council called Weight Management and Weight-Related Behaviors. In 2019, the Spina Bifida Association surveyed members of the Spina Bifida community. And in that survey, we learned that 44% of adults living with spina bifida identified managing weight as a top concern, and then identified through other means, focus groups and other ways, 5 different questions that were of concern among this population. So the goal of the weight management and weight-related behaviors work group is to really begin to better understand those questions and hopefully provide some answers to those questions. So when we started out identifying which question we're going to address first, we discovered quickly that there isn't a lot of information on any of the questions. And in fact, there's not a lot of data. And so to test a hypothesis, to really study the questions and provide some scientific answers, we needed data. So our first steps became, how do we get data? And we did so by conducting some surveys. So to address some of these questions, we began with, what are the current practices governing weight management and weight-related behaviors by healthcare providers? And to get at that, we conducted a survey on beliefs and attitudes about obesity among healthcare providers who treat patients with spina bifida. We collected 75 respondents, and we are currently analyzing data. The other part of that question are members of the spina bifida community living with spina bifida, trying to manage their weight and weight-related behaviors. So our next step is creating a survey to collect information or data from adults living with spina bifida so that we can also identify what are their current practices in how they manage weight and weight-related behaviors. The goals of both of these surveys is to provide information about practices and perhaps best practices for managing weight, both from the healthcare provider and the adult living with spina bifida, those 2 different perspectives. We also hope that we will be able to identify some important resources that are helpful in managing weight and weight-related behaviors, and identifying any barriers to access those resources. So we hope you will keep looking back at the SBA website for updates on our research as we get more information, and as for the first survey, as we start getting some preliminary results. We're excited to share that information because we know it will be helpful to this community. Thank you so much. Okay, I hope you enjoyed that presentation. We'll now take a few minutes to answer any questions you might have raised at this time. Juanita, I'll turn it to you.
Thank you, Laura. And there are no questions yet, but just like last time, I'm sure we'll have a couple pop in. So please go ahead and submit your questions through the chat or through the Q&A. Be watching both. And in the meantime, Laura, you have some good questions too.
Thank you. It looks like my slide might be out of order, so I'll just go ahead and ask a more general question about what we just saw in terms of mental health and the weight weight management. Are there any participants who want to share what they're most interested in about those questions that we're asking? Any ways that you want to share how those results, once we have finished our studies, might help you? These are things that can help us in terms of when we get results and we present the results, there's a lot of information. And so being able to have some feedback on what information would benefit you most would be very helpful. I'd also like to share that we will, as I mentioned in the video, we're really excited and very close to sending out the survey to adults with spina bifida about their practices for managing weight, about how they communicate with their healthcare providers about weight, how often they communicate, and if those communications are effective and ways that maybe they can be more effective. So if that's an area of interest for you, we would love for you to participate in that survey when it's ready, and it should be out pretty soon.
And there is a question. It says, I would be very interested in learning about all of the research results presented in this session.
Excellent. Well, thank you for asking that question and sharing that comment, because one of the goals for SBA in 2024 is to create a more centralized location, a research corner, for example, on the website, so that it's easier for our community to just click on and see what's the latest research that has been conducted, what studies are ongoing. That information is currently on our website, but we're trying to improve it and make it so that it's a little bit easier to find and allow you to also add comments to those research studies that are ongoing. So thank you for your interest.
Oh, and you got a heart.
Any other questions?
I don't see any more questions at this point.
Okay, so
Our time is close. Yeah.
Yes, we got 20 minutes.
Oh, so move on, Judy. Is that what you're saying?
Yes.
Okay, moving on. The next group that we're going to watch a video from is on self-management. The working group leader is Audrey Roach, who is present with us tonight. So thank you, Audrey, for being here. The questions that this group are addressing are: how do factors such as executive functioning, gross motor delays, surgeries, things of that nature interact with the introduction of self-management interventions to influence outcomes? These questions are long, and then they get shortened into more simple hypotheses once they have some data. What self-management interventions for spina bifida are helpful and available for educators, mental health providers, rehab specialists? How can we support individuals in the development of self-management skills, abilities, responsibilities, strategies, techniques across a person's lifespan? How do factors that predict self-management behaviors in youth impact outcomes in adults and their families? And the outcomes here, just some examples, are health, employment, quality of life. And lastly, how does executive functioning of the individual play a role in their self-management ability? So again, very important questions. These are, as you can tell, as with most of the other groups, they're very big, complex questions, which is partly why it takes some time to study them and to find, conduct some research. And as with any research, it starts out with a bigger, broader question, and then it gets more narrow in a specific hypothesis. And Audrey in her video will share a little bit more about those hypotheses.
Hello, my name is Audrey Roach. I am a nurse and the Spina Bifida coordinator at Children's Wisconsin. I lead the self-management work group within the Spina Bifida Association's Research Advisory Council. Our self-management work group contains a diverse background of clinicians and researchers from across the country, and several participants have spina bifida. There's a definition of self-management on the poster, but in short, self-management is taking responsibility for one's own behaviors and well-being. We know that increasing self-management behaviors leads to better health outcomes and quality of life for people with spina bifida, which makes this an important area of research. Self-management is also connected to several of the other important topics that the spina bifida community identified through the community-centered research agenda, such as bowel and bladder continence and transition to adult healthcare. There are 3 topics our work group is currently focusing on that I would like to mention. First, we are discussing how to measure self-management. How do we quantify a concept like self-management to be able to say that one person is better at self-management than another, or that the same person has increased their ability to self-manage over time? We are comparing various interview questions and survey tools that measure self-management to assist us in our research. We are also exploring what factors promote or inhibit self-management behaviors. Some of these factors could be related to spina bifida, such as having a shunt or not. Others might be part of the socio-demographic context, such as if a person lives in an urban versus a rural area. We are also interested in determining if setting mutually agreed upon goals among individuals with spina bifida, caregivers, and the healthcare team increases self-management behaviors. Finally, we are researching tools that can support self-management, especially the use of technology through mobile applications. Most teenagers and adults have a phone or tablet. Therefore, could an app help organize medical information, provide reminders for daily tasks and cares, and enhance communication with healthcare providers? We hope so, and are in the process of conducting additional research that will make an app more broadly available to people with spina bifida. I am excited about these projects and hope that you are too. Thank you for your interest and support of the Spina Bifida Association's community-centered research agenda.
Thank you, Audrey. I hope everyone enjoyed that and is already thinking of the questions that they want to ask since she's here tonight in the Q&A. While you're doing that, I'll move forward with the next work group leader, Robert Treeweiler, who is the leader for transition. This group is working on several questions, one of which is, how can medical professionals help parents to support their children as they become adults? What can healthcare providers do to best support transitioning adolescents to adult services? For adults with spina bifida who are or were working, what helped make their employment success? And then identifying barriers to independence faced by individuals with spina bifida from groups that are frequently marginalized and excluded, and identify ways to help these groups overcome the barriers. Finally, what are the most important actions that help or hinder children with spina bifida in learning the skills needed to become an adult?
Hi, I'm Robert B.T. Treeweiler. I'm the team leader for the Research Advisory Council's Transition Work Group. By professional training, I'm a certified rehabilitation counselor, so I have a keen interest in transitioning to employment and community living. the transition research group identified 5 research questions, which you see, to focus on in looking at the transition of young adults with spina bifida into their adulthood years. Currently, we're pursuing a literature review, and we've had 154 published manuscripts identified. We're going through the manuscripts to see how they relate to our 5 research questions. Specifically, we want to see if, there's been adequate research or if there are gaps. So the question about, what can healthcare workers do to best support transitioning adolescents to adult services, we're looking to see what research has already been conducted and in what groups of young adults they've conducted them on. Based on that, we can see if more research is needed in those areas. We also want to look at going into employment and community living and what's been done there. And another area we want to look at are people with minorities having research for their needs conducted. So this is an ongoing process. We're right in the middle of reviewing the articles, so unfortunately I don't have an update on where the gaps are or where the actual research has been, but this is the main thing our group is pursuing so that we can then further encourage research in this area. Transition to adulthood is extremely important for young adults with spina bifida as they leave high school and enter the adult world, whether through college or work or community living. We want to be able to help those young adults and their parents to have the best information possible. Thank you very much for allowing me to present. Goodbye.
Okay, I hope you enjoyed that final video that we have for you tonight. Before we continue with the final parts of our session this evening, I'll turn to Juanita and ask if she has received any questions.
Yeah, there were a couple of questions, and I think Judy might have answered a couple of them, but there is one that said, how best can caregivers and people with spina bifida manage stigma in the society?
And I wonder, Laura, if others on this call might have some insight about that question.
That's a great idea. Would you like them to put it in the chat and we can maybe share some of that?
Yeah, that'd be great.
Yeah, so if you want to share how the question was, how can people with spina bifida manage stigma for having associated with someone who has spina bifida? Is that correct, Juanita?
Yes, yes, exactly. How can people with spina bifida manage the stigma?
Oh, go ahead.
Sorry, I'm sorry. I'm just pulling out the questions again. I was on the chat, and yeah, it was how can caregivers and people with spina bifida manage stigma in the society? And and I see that Audrey Roach is actually providing a response to that question.
Audrey, would you share her response?
Sure, I will. It just disappeared. Here it is. Okay, Abdul, I think providing education to communities and trying to increase inclusivity for people with spina bifida and other disabilities decreases stigma over time.
I agree, and thank you, Audrey. I would also say, as an adult with spina bifida, that being out there, doing everything you can in the community, and as often as you can, because the more they see us, the more they will see that we are just like anybody else, people with different abilities, and we have wonderful abilities, and that can be shared with the community. And I think that presence can go a long way in reducing any stigma that is out there.
And there was a good comment, and I'm not sure if it was related to stigma, but it's a good point. I wonder where the lack of accessible access to healthcare offices, exam tables, even scales fits into this, and how do we make this better?
tell your providers, because often, at least in my experience, they're not aware that the bathroom that you're using, for example, is not accessible because they're behind the scenes and they're treating patients, they're in the clinic, they're in their exam rooms, they're in the operating room, and they're not in those restrooms. So share that, share what your experience is with your caregivers and see if they can make a difference as well. Any other ideas that are in the chat or from our panelists?
Well, we have a couple of more questions, and one of them is, after living a normal life at age 68, I found that I have spina bifida. Since then, life has changed dramatically. The transition has been very difficult. Is this situation being looked at?
So transition later in life, you mean? The transition of going from more fully able to having different abilities?
Yes, it sounds like that's the question, because it was the person discovered they had spina bifida at 68.
And I wonder if the person finding out that the diagnosis of spina bifida, were there, as you said, Laura, were there functional changes that made life so challenging? Because Leah said life has changed dramatically.
Yeah, and oh, sorry, go ahead.
I was just going to add, thank you for sharing that, and thank you for asking that question. I think self-management, and in particular transition, are working groups that the information that they'll provide as they're conducting the research will help address those questions. So sometimes we won't be answering or studying a specific question that you have, but it's related. And so the information we get from trying to address one question helps us often address another question. And so my hope is that in those two working groups, and especially in transition, we'll be able to provide you with more information as we start addressing more of those questions.
Thank you, Laura. And there's another question here related to weight management and depression. And it is, are there questions in your research that can link depression and obesity or weight management concerns?
Of the questions that the weight management and weight related behavior, of those questions that we're researching, none of them ask a specific question about mental health and obesity. But here again, the information we find on one question might lead to that. For example, one of the questions that we're addressing is what are the strategies that help those who have been able to maintain and manage a healthy weight and healthy lifestyle? And what are the strategies that don't work? And what are the barriers? And one barrier might be depression. We also, on that particular working group, we have the benefit of having researchers who have examined some of those relationships. And at the World Congress, there we had a panel that had people studying mental health and how its links to obesity and overall quality of life. So there's research out there. We're not addressing it right now. We're looking first to get some healthcare providers information. In their responses, though, one of the responses is mental health. So why don't you exercise more? I'm depressed. And so we're hoping that we can find more information about that link. Did anyone else like to add?
There's a couple more comments, and one was made earlier, but I think it's a global comment that educating our family members is important. And I just wanted to bring that up. And then in the chat, in response to the stigma question in the community, One of the additional comments was to get out in the community so people can see how capable those with disabilities can be. We take our daughter ice skating, but in a hockey sled, adaptive rock climbing, off-road cycling, be part of an adaptive program if possible.
Absolutely. Thank you for sharing that. I couldn't agree more.
And at this point, I don't see any new questions.
Thank you to the Research Advisory Council leaders. Thank you for those who are here tonight on the Research Council, Hubert and Audrey. Thank you to Judy and Juanita and all of the people at the Spina Bifida Association who really make these events possible. Above all, thank you to all of you participating. We hope that this was fun and that you learned something. And as Judy mentioned earlier, there is an evaluation we would appreciate you completing so that we can learn on what we want to do next and what we can improve on. And wishing you all a very happy and safe and healthy holiday season.